All right. What's your name?
David Robertson,
And where are you from?
Chicago, Illinois.
Okay. Do you have a healthcare or medication access nightmare that you'd like to tell us about?
I do. I applied for about 8 months to ADAP last year, and they rejected me every time because they said I didn't have sufficient financial information because I was a college student, and my financial aid report did not prove that I had income. Even though I had student loans to live off of, they kept rejecting it, saying that I had no W-9 information. So about 30 days ago, I finally got a letter in the mail saying I was approved just for 6 months.
And how have you been getting your medications without being approved for that assistance?
I would have to make the trek all the way back to the Core Center on the west side of Chicago every month, going right back into seeing my doctor over and over again every 30 days to get my medication.
I see. So it was on sort of an emergency basis?
Yeah.
Got it. And if you're receiving medication in healthcare, how has receiving this medication in healthcare changed your health or your life?
Well, A, I'm undetectable, and B, my lifestyle is a lot more healthier, and I'm not stressed out, I'm not worried. I'm more effective in my schoolwork.
Great. And what do you think would solve the healthcare and treatment access crisis that HIV positive people are facing?
I really think that there was an advisory board that that individuals helped when they were passing these bills could come as a camaraderie and have talk about these things to see individuals who are not only affected but infected to have the conversation and be better, because individuals who are making these laws or putting them together, if they're not an expert living with it, they really don't know exactly how it's effective or non-effective, rather.
And what would you like to tell politicians who have the capacity to add or subtract funding for HIV/AIDS medications or expanded health care?
I'm one of many college students that I know that have the same issue. Not only are we full-time college students, but the additive of not having our medication coming on a regular basis, finals, homework, that's a stressor, and it was hard. You know, I got severe depression, not knowing how I was gonna get my medication, and didn't want my numbers to drop and get sick. So I would definitely say that it's important not only for the older generation, but for the generation trying to get an education and survive.